Right now, hundreds of members of Congress are grappling with the details of health care reform and getting an earful from voters. Let's bring in our senior congressional correspondent, Dana Bash, and you spent some time with one lawmaker who is listening to a lot of folks, as well as his conscience.
That's right. I went to see a freshman Democrat who left Washington, left the Capitol 5 weeks ago undecided. He still is. And we spent some time together as he talked to constituents and also as he delivered a tough message for the president.
Here's something you haven't seen during the summer of angry town halls.
Thank you. Welcome so much for coming to my home.
Oh, my pleasure.
Really appreciate it.
Thanks for having me.
This is my
A healthcare house call. Democratic Congressman Gerry Connolly at Susan Burton's table, invited to hear her explain why she may have to cut health coverage for workers at her small business.
1,000 for family coverage. So that's the one we went with. That's outrageous for a group.
Connolly, a freshman, wants to back health reform but is wary because his Virginia district is fairly conservative. Afterwards, the congressman lamented that deep concern he heard here about the current health care system has been drowned out.
Why is public opinion turning against health care reform if you have stories like that?
Well, partly. We've had a steady drum beat of the negative, playing on people's fears and anxieties, and to some extent that's clearly taken hold. This is the bill. This is the bill.
In a car ride through his district, Connolly blamed his own party, especially the president, for losing control of the debate.
Yeah, I think the White House candidly underestimated the passion on the other side. I think we underestimated the ability of the opposition to, really initially frame the issue in outlandish ways.
Yeah. Connolly goes back to his district office to see Democratic groups scrambling to reframe the debate and get his vote.
That was the whole point of us getting people elected.
Members of a local union there to lobby him in one room, and in another, volunteers from the president's political group, Organizing for America, deliver a box of petitions and bring emotional stories of pre-existing conditions that make insurance unaffordable.
And I had to resign from my job because of my health issues.
Connolly says those meetings are effective, but back in the car, this Democrat with conservative constituents says what he really needs is better leadership from the president.
We need Obama to maybe put aside the cool cerebral part of himself. He has to show some passion.
Connolly says if House Democrats change their health care bill to better control medical costs, he would support it and knows it could cost him his seat.
That you had to keep your head clear and to never sell your soul, you had to be willing to go into this business saying to yourself and meaning it, there are some things worth losing an election over.
Could this be one of them?
For me, yeah.
Now, Connolly was just elected in November. Before that, a Republican represented his district for 14 years. He told me that it's time for the president to take advantage of his big Democratic majority in Congress by engaging, he said, quote, Suzanne, roll up his sleeves and cut a deal. That's what he wants the president to start doing.
And you mentioned during the break that this all happened this morning, all those different meetings that he was involved with.
That's right. At the House, and the 2 meetings in his district office, they were over by 11:30 this morning.